Are you taking supplements hoping to boost your health, feel younger, or just keep things running smoothly as you get older? What if some of those very supplements, the ones you pick up confidently from the pharmacy or health food store, could actually be working against you, causing hidden dangers you're not even aware of? It's a painful reality that many of us over 60, with the best intentions, might unknowingly be putting our health at risk by combining supplements with prescription medications, or by taking dosages that are simply too high for our changing bodies. We assume that if something is available over the counter, it must be safe, but that's not always the case, especially as our bodies process things differently with age. The truth is, sometimes what you don't know can truly hurt you, potentially leading to serious complications that could even land you in the hospital. The real secret isn't just about what magical pill to take for better health, but rather understanding what not to take, or at the very least, not without the right guidance. In this video, we're going to pull back the curtain on 3 very common supplements that countless people over 60 use, but which carry significant and often overlooked risks if taken without first having a crucial, open conversation with your doctor. This isn't about scaring you, but empowering you with vital information for your safety and well-being. So, watch to the end for something that will surprise you. A simple truth that could fundamentally change how you view your daily health routine forever. Let's dive right into the first one. A supplement almost synonymous with healthy bones and preventing osteoporosis as we age: high-dose vitamin D, especially when combined with calcium. Now, there's no denying that both vitamin D and calcium are absolutely essential for our bodies. Vitamin D helps our bodies absorb calcium. And calcium, of course, is the fundamental building block for strong bones and teeth. As we get older, our ability to absorb vitamin D from sunlight can decrease. And many of us don't get enough calcium from our diet, so supplementing seems like a logical, even necessary step. We see these supplements marketed everywhere, promising stronger bones, better immunity, and a general sense of well-being. It's easy to think, more is better. Right, I need to protect my bones, and for many years, that was the prevailing wisdom, to simply take these supplements to prevent fractures. However, here's where the but comes in, and it's a big one, especially for those of us over 60. The danger isn't in vitamin D or calcium themselves, but in taking them in high doses, particularly without knowing your body's actual needs, and especially without understanding how they interact with your unique physiology and other medications you might be taking. One of the most significant risks of excessive vitamin D and calcium intake is a condition called hypercalcemia, which simply means too much calcium in your blood. You might think, isn't more calcium good for bones? Yes, but that calcium needs to be in your bones, not floating around in your bloodstream in high concentrations. When blood calcium levels become too high, it can lead to a range of uncomfortable and even dangerous symptoms. Initially, you might notice subtle things like increased thirst, frequent urination, nausea, a loss of appetite, or just feeling unusually tired and weak. These can easily be dismissed as just getting older or signs of other conditions, which is part of the insidious nature of this problem. As hypercalcemia worsens, it can progress to more severe issues like kidney stones, kidney damage, bone pain, confusion, depression, and even irregular heart rhythms. Imagine being told you have kidney stones, only to find out it's from a supplement you thought was helping you. Beyond hypercalcemia, there are other crucial considerations. For instance, high doses of calcium, especially when not truly needed or without enough vitamin K2 to direct it, can potentially contribute to vascular calcification, meaning calcium deposits building up in your arteries. This isn't a direct cause of heart disease, but some studies suggest it could be a contributing factor or a marker of underlying cardiovascular issues, something we definitely want to avoid as we age. Furthermore, vitamin D and calcium supplements can interact with several common prescription medications. If you're taking heart medications like digoxin, which helps regulate your heartbeat, high calcium levels can increase your risk of digoxin toxicity, leading to serious heart rhythm problems. Certain diuretics, often prescribed for high blood pressure, can also increase calcium levels in your blood. making the combination with supplements potentially problematic. Even some antacids can contain calcium, adding to your total daily intake without you even realizing it. This is precisely why your doctor needs to know exactly how much vitamin D and calcium you are taking, if any. They can perform a simple blood test to check your current vitamin D levels, which is the only accurate way to determine if you truly have a deficiency and how much supplementation you might need. They can also assess your kidney function to ensure your body can handle the calcium you're ingesting and review your entire medication list for any potential interactions. They don't just prescribe blindly. They consider your entire health profile. Self-dosing, especially with high-potency supplements, is akin to trying to fix a complex engine without knowing what's under the hood. You might think you're adding the right fuel, but you could be causing internal damage. The goal is to find that Goldilocks zone, not too little, not too much, but just the right amount that is tailored precisely to your unique needs and health status. So, before you grab that next bottle of high-dose vitamin D and calcium, make an appointment with your doctor. It's a conversation that could prevent a world of pain and serious health complications down the line. It's about empowering yourself with accurate information. Now that we've discussed the crucial role of vitamin D and calcium and the risks of mismanaging them, let's turn our attention to another popular choice, especially for those hoping to keep their minds sharp and focused as the years go by. Now that we've talked about the crucial role of vitamin D and calcium and the risks of mismanaging them, let's turn our attention to another popular choice, especially for those hoping to keep their minds sharp and focused as the years go by: ginkgo biloba. For decades, ginkgo biloba has been touted as a natural way to boost brain health, improve memory, and enhance circulation. You've probably seen it on the shelves, often promoted with images of calm, focused individuals or intricate brain diagrams. The idea is appealing a natural plant extract that can help keep our cognitive functions humming smoothly, perhaps even ward off age-related memory decline. And indeed, some early studies suggested benefits for circulation and even some mild cognitive enhancement in specific contexts. It's very understandable why someone over 60 would reach for this supplement, hoping to maintain their mental agility. However, just like with vitamin D and calcium, there's a significant but to consider, and it primarily revolves around ginkgo biloba's potent blood-thinning properties. While improved circulation sounds wonderful, if you're already on medication designed to thin your blood, or if you have certain underlying health conditions, this property of ginkgo biloba can become incredibly dangerous. Ginkgo can significantly increase the risk of bleeding. Imagine you're taking warfarin, aspirin, or one of the newer oral anticoagulants like Xarelto or Eliquis to prevent blood clots. And many people over 60 are, especially if they have a history of heart issues, stroke, or atrial fibrillation. Adding a ginkgo biloba to that regimen is like pouring gasoline on a small fire. It can dangerously amplify the effects of these prescription blood thinners, leading to an increased risk of internal bleeding, gastrointestinal bleeds, nosebleeds that won't stop, or even hemorrhagic stroke, which is bleeding in the brain. These are not minor side effects. They can be life-threatening emergencies. Beyond direct blood thinners, ginkgo biloba can also interact with other common medications. If you're taking non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen or naproxen, which many of us use for everyday aches and pains. The combination with ginkgo can also heighten your bleeding risk, even before a minor surgery, whether it's a tooth extraction or a cataract operation. Doctors typically tell you to stop taking blood thinners if you're taking ginkgo biloba and don't inform your surgical team. You could be facing serious complications during or after the procedure due to excessive bleeding. Furthermore, ginkgo has been shown to interact with some medications for diabetes, potentially affecting blood sugar levels, and even certain antidepressants. This complex web of interactions means that what seems like a harmless natural boost could, in fact, be sabotaging your carefully managed health regimen. This is why it is absolutely critical that your doctor knows about every single supplement you are taking, including ginkgo biloba. They need to be aware of any potential interactions with your prescription medications, and they may need to monitor your blood clotting times more closely if they decide that the potential benefits outweigh the risks for your specific situation. Don't assume that because it's natural, it's automatically safe to mix with your doctor-prescribed medications. Natural substances can be incredibly powerful, sometimes as powerful, or even more powerful, than pharmaceutical drugs. Your action step here is simple but profound. Be completely transparent with your healthcare team. Make a list of everything you take, every pill, every herb, every vitamin, and bring it with you to every doctor's appointment. Before any surgery, specifically mention ginkgo biloba and any other supplements you're taking. Your honesty is your greatest defense against these hidden dangers. And finally, let's talk about a supplement that many turn to for a mood lift, especially during challenging times or for managing the natural fluctuations of life. St. John's wort. This yellow-flowered plant has gained immense popularity as a natural remedy for mild to moderate depression and anxiety. It's often seen as a gentler alternative to prescription antidepressants. And for some, it might seem appealing to try something from nature before turning to pharmaceutical options. The appeal is understandable. Feeling low or anxious is tough, and seeking comfort from a natural source feels intuitive. However, St. John's wort is perhaps the most notorious supplement when it comes to serious and widespread drug interactions. While it might offer some mood-lifting effects, its interaction profile is so extensive and potentially dangerous that many medical professionals strongly advise against its use, particularly for those on multiple prescription medications, which is often the case for individuals over 60. The core of the problem lies in how St. John's wort interacts with liver enzymes. It significantly impacts the cytochrome P450 enzyme system in your liver, which is responsible for metabolizing, or breaking down, a vast number of prescription drugs. When St. John's wort speeds up this system, it causes your body to process these crucial medications much faster than intended, meaning less of the drug gets into your system, rendering it less effective, or even completely ineffective. Imagine your vital medication simply being flushed out of your system before it can do its job. The list of medications affected by St. John's wort is incredibly long and includes many drugs critical for the health of people over 60. For example, if you're taking antidepressants, especially selective serotonin reuptake inhibitors, or SSRIs like Prozac, Zoloft, or Paxil, combining them with St. John's wort can lead to a potentially life-threatening condition called serotonin syndrome. This happens when there's too much serotonin activity in the brain, causing symptoms like agitation, confusion, rapid heart rate, high blood pressure, muscle rigidity, tremors, and even seizures or coma in severe cases. This is a medical emergency that requires immediate attention. But the dangers don't stop there. St. John's wort can also significantly reduce the effectiveness of blood thinners, increasing your risk of dangerous blood clots. For someone at risk of stroke or heart attack, this is simply too big a gamble. Interfere with immunosuppressants, drugs vital for organ transplant patients to prevent rejection. Taking St. John's wort in this context could lead to organ failure, decrease the effectiveness of certain heart medications, like digoxin, which is used for heart failure and irregular heartbeats, potentially leading to a worsening of your heart condition. Reduce the effectiveness of birth control pills, which, while perhaps less of a concern for the over 60 audience, highlights how broadly it impacts crucial hormonal regulation. Impact the effectiveness of many HIV/AIDS medications, cancer drugs, cholesterol-lowering statins, and even seizure medications. If you're relying on these drugs to manage chronic conditions, St. John's wort could undermine your entire treatment plan without you even knowing why your condition seems to be worsening. It can also increase your sensitivity to sunlight, making you more prone to severe sunburns. The bottom line is this: never ever self-treat depression or any other serious mood disorder with St. John's wort without a thorough discussion and ongoing supervision from a qualified healthcare professional. If you are already taking St. John's wort and are prescribed any new medication, or if you are currently on any of the medications I've mentioned, it is imperative that you inform your doctor or pharmacist immediately. They can help you understand the risks and guide you on the safest path forward, which may involve discontinuing St. John's wort under their supervision. This isn't just about caution. It's about avoiding potentially catastrophic health outcomes. The promise of a mood lift simply isn't worth the immense risks when it comes to your overall health and the effectiveness of your life-sustaining medications. We've journeyed through the complexities of high-dose vitamin D and calcium combinations, which, while essential, can become problematic without proper guidance. We've uncovered the sneaky dangers of ginkgo biloba, a seemingly benign memory booster that can wreak havoc if you're on blood thinners. And we've explored the vast minefield of St. John's wort interactions, a mood enhancer that can render critical medications useless or dangerously potent. The core message here is not to instill fear or to tell you to avoid all supplements. Quite the opposite. In fact, it's about empowering you with crucial knowledge so that you can make informed decisions and truly take control of your health in the safest, most effective way possible. Remember, supplements are powerful. Many of them are biologically active substances that can act like drugs in your body, influencing various systems and interacting with other compounds you ingest. As we age, our bodies change how they absorb, metabolize, and excrete substances. Our kidneys and liver might not be as efficient, and we often find ourselves on more prescription medications, increasing the likelihood of unforeseen interactions. This isn't a flaw. It's just a reality we need to acknowledge and work with. And now for that surprising truth I promised at the beginning, the one that could fundamentally change how you view your daily health routine. Many doctors don't routinely ask about every single supplement you're taking. They might ask about prescriptions, but often, the conversation stops there. They're busy, and they might assume that if you're taking something important, you'll volunteer the information. This means it's actually your responsibility to initiate that conversation. You are the CEO of your own health, and your doctor is your most vital advisor. To truly empower your doctor to give you the best, safest care, you need to provide them with the complete picture. Make a list of every single thing you put into your body, every vitamin, mineral, herbal remedy, and over-the-counter pill, alongside your prescriptions. Bring that list to every appointment. Be open, be honest, and ask questions. Is this supplement safe with my blood pressure medication? Could this interact with my diabetes drugs? Do I even need this much vitamin D? These are the conversations that protect you. Small changes, combined with accurate information, truly can make a monumental difference to your health and happiness as you navigate the golden years. Your well-being is not just about what you take, but about taking it wisely, with knowledge and collaboration. So, have you ever experienced an unexpected reaction to a supplement, or learned something surprising about its interactions that you wish you knew sooner? We'd love to hear your story and your insights. Please share your experiences in the comments below. Your wisdom and what you've learned could genuinely help someone else who might be in a similar situation. Navigating the same questions. If this video has opened your eyes, perhaps made you rethink a supplement or two, and helped you think differently about your health journey, please give it a thumbs up. Your likes help us know that this information is valuable to you and encourages us to create more content like this. And, of course, don't forget to subscribe to our channel for more practical, clear, and empowering health advice designed specifically for living your best life over 60. We are committed to bringing you reliable information that helps you thrive. Remember, your health journey is unique and armed with knowledge and the right support. You have the power to navigate it safely, confidently, and vibrantly. Keep asking questions, keep learning, and keep thriving. Live your best life at every age.